partner is a general surgeon who semi-retired over in Polson. Very excited about coming here, and we're hoping to get it in December. But sometimes, you know, even in these tight cash flow situations, you have to invest a little money in those surgeons. Although we don't have to invest too much, the equipment is already there. You know, the foundation board bought an operating microscope, you know, for Dr. McClellan.
You know, and when we had surgery here, a previous doctor, that was part of your revenue. You know, now there's.
Well, there's some, but we need more. And we need the community, especially young couples and, kids, my grandkids' age, with Dr. McClellan. I mean, ear tubes and tonsillectomies, and, you know, he's very good at those sorts of things. That's kind of a bread and butter kind of thing with surgeons.
As long as I'm being naughty, do you think that we're a little bit too top-heavy? I mean, we've got more than we ever had, and they've got administrators to the administrators, and I'm going, where does all this money come from to pay for all these people?
Very, very point well taken.
$2,100,000 in debt, mortgages.
I'm not sure of the numbers. You know, that's
Oh,
one
yeah.
thing we haven't. I've not heard that number, but
The mortgages are on file, recorded in the clerk and recorder's office, and anyone has access to them. The first one was over $1 million, and the second one, not too long ago, was $600,000. That's over $2 million. What
In debt.
In debt. And who's going to have to end up paying for that?
Surely one, and I don't know the number either, but the documents that are recorded are going to show you the amount that it was owed at the time they were recorded.
Right.
The first one, and the 600,000 is relatively new.
Right.
The first one is substantially older and has probably been paid down quite a bit from the time it was recorded. They don't change it every time there's a payment made.
No, I know that. I mean, I worked in the clerk and recorder's office. I recorded those.
Yeah.
And what is the interest rate on those? And what are your payments a
And
month?
I don't have the answer to that, as I said.
What are your payments a month? Are you making them?
oh yes.
And
We're making all.
Shirley, we appreciate you bringing that up, and we'll look at that from your perspective and try to get back to you on that.
You know,
because
back
that's
to your
good
other
information.
point, which I think is very well taken. I mean, we are, this process that Cindy and I are talking about, we're going through our organization anyway, and I think Cindy's doing the same, but we're going through, the only way to solve a budget or cash flow problem, there's only two ways. You increase revenue, come and use our surgery, come and use our long-term care, come and use our primary care. That helps us. That's the best thing you can do for us right now, is to use our services. The other way is to reduce your costs. I mean, that's the only way to solve a cash flow problem. And we are going through 12 hours a day with our teams, going through line by line every contract expense, every supply expense, every people expense, every position. And we will have those plans in place. You got to give us a little more time. We're not quite there yet, as Cindy said, but we will have a plan to get this thing in balance and to pay down that debt and to pay down that cash flow issue that I'm talking about. I mean, we have to get there. I mean, it is a serious problem, and we will get there, but we're right in the middle of that process.
I did budgets for many years. I worked for the county for 40 years. I did budget, payroll, you name it.
We might be getting you on our board, Shirley. I have a question back here.
No!
I just have a question back here.
Well, I guess I'd like to make a quick comment from
You bet.
what John was saying, that it is a moving target, how much you owe. you
Right.
know, And anywhere.
Exactly.
And in a service area like this, there might even be the opportunity for some debt grace. To me, that's a third possibility to increase cash flows. You can make some arguments here, and I'm not sure about billing for, I'm not going to talk about billing, except that across the country, we've had difficulties with billing, and we've had, whether it's in-house or out-of-house, may have been done properly, or maybe it started off properly, but then other people picked it up, and there may have been some loss of revenue that really the hospital could appeal and say, well, we're owed some of that. It went to the wrong pocket.
Possibility, yeah, possibility.
Yeah, we're looking at
On
everything.
the, I would say on the hospital side, it's a little bit different than the clinic. Deb Green, for those of you who know who Deb is, Deb actually lives in Plains, but she's commuting back and forth every day. And she is just an absolute jewel with billing. I mean, she's an expert on Medicare and Medicaid billing and private insurance, and she has been working very, very hard to bring our receivables balance. That's the other picture with the cash flow. That's we were playing catch up until just the last couple of weeks. We've had some strong collections the last 3 weeks or so. Before that, even before that, but it's been particularly strong. And so that, you know, the bills are going out on the hospital side. They are going out, and the cash is coming back in, maybe a little bit in advance of some of the issues that Cindy's been dealing with over in the clinic. And don't forget, I mean, I don't minimize this at all, but the bills on the clinic side are much smaller than the Medicare bills that we have on the inpatient side or the long-term care side. In most cases, the outpatient bills for lab and x-ray and those sorts of things are smaller as well. But you know, some of the bills on the hospital side are some of the revenue that comes in bigger chunks, so it's easier to get at it, you know, to get it corrected and then turned around and back to us. So we're in the throes of all of that right now. And it is getting better. It's getting better. And Cindy is, I know, working very hard, certainly on the clinic side.
Another question I
Julie,
have.
can I hold you just for 1 minute, because we had someone else? I just want to make sure we hit everybody.
Okay, I just have a quick question. You're talking about cash flow and everything, and, you know, I know the community's been hearing a lot about the new hospital that you guys, that, you know, Mineral Community planned on building, and the land up here, and, you know, we had went through this big rigmarole about our chamber sign, you know, it needed to be moved, and now you're talking about building a clinic at or in Alberton, and you've got, you know, you've built a clinic at St. Regis, and, you know, so what are your plans? I mean, are you still planning on building a new hospital?
Good question.
Are you still
Larry?
planning
Well, on
on
the
building a
hospital
clinic
side,
in St.
no,
Alberton?
it ain't gonna happen.
Yeah.
Not now. I mean, you need a new hospital. When I was in Malta, it took us 9 years to get a new hospital built.
But you know what? You know what we need? We need another assisted living. We're
Well, I
a
agree.
senior community, you know,
I
and
agree.
instead of building us a brand new hospital, then, you know, a lot of our revenue comes from the emergency room. Build a new emergency room, you know? Take care of the nursing residents, the nursing home people that we have there right now. Take care of them. Do your emergency room, you know, make it, you know, one of the best ones. I mean, we're supposedly the
Number one.
number one in the state of Montana or whatever, but we're a senior community, and, you know, we don't have enough housing, and there's a lot of seniors in the community that I think, you know, I mean, that's what we need to be looking at.
Yeah, I agree 100%. You're right on target, right on the spot. It was a very unusual decision to move forward with a capital campaign like the community did with the hospital. I've never seen it done like that. And then also the investment in plans for a new hospital. A considerable amount of money was spent on architectural plans before the funding was secured. Well, the funding didn't happen. I mean, you all know that. And it can't happen right now. I mean, it's just not going to happen. You know, John Updike came to this community with the commitment that he was brought on to be here because of the new hospital, you know, being built. And it's not happening. I mean, that certainly is not happening.
You should tell the public that.
I am right now, I guess.
Pardon?
That's what's
Put it in the paper.
Yes,
Say,
yes.
we are not gonna build it at this time.
Oh, no.
Because the public thinks you're gonna, and they're upset about it.
Yeah, well, I don't blame her.
You gotta wipe out yesterday's history.
That's right.
Right. And get everything back on the right track.
And we're brand new, starting over.
Right.
And there's a lot of trust in the community that has, you know, I mean.
All those things are difficult on
You know, I mean, they did, you know, you bring new administrators in, you know, and you know, you want to believe in them and you want to believe everything that they say and everything that they're doing. And I mean, the community has known for how long, you know, that what they were doing was way bigger than what we were, you know, what we were capable of.
The people weren't here.
Sure.
Yeah, you know, but I mean, and if you don't, you know, I mean, you need to be more open. It can't be a secret.
Right.
And that's what it's been.
Well, you're not gonna
couldn't
get
get
that
a
from
word,
Cindy.
you couldn't find out anything. Everything was a secret. Everything was behind closed doors.
We understand it
And
was
like he
horrible.
says, you know, people
Yeah.
think that there's gonna be a hospital up here.
Can't do that.
Yeah. So I'm just going to address the clinic in Alberton that you brought up. So at this point in time, here's what I know. They received some money to build a school-based clinic, and the money, you can only use it for capital. There is not a dime in there to turn the lights on. Okay, it seems absolutely unethical to me to go forward with that. But we started a discussion in Alberton today. If we will work with what we have to look at what you just finished saying. This is a county of less than 4,000, right around 4,000 people in a 65-mile ribbon of beauty. Absolute beauty.
85% federally owned.
Yes, we had that discussion. And the majority of people that live here, as in all rural areas of the United States, we're older. I am not in my 20s anymore. We're older. And so what do we need here for health services? If I'm in Alberton, literally, folks, there is no one that doesn't go shopping in Missoula that lives in Alberton.
Exactly.
I'm like, it's 24 miles away, for the love of heaven. Go. Good for you. I mean, there's nothing wrong with that. So what size of, like you, one of you, I think you just said it, what do we really need here? Well, we need assisted living, long-term care, a nice, functional, state-of-the-art, how do we take care of a trauma and get you to Missoula, because you're not going to stay here with your head cut off. We're sending you to Seattle. And how do you have a really good primary care clinic here, but you can't have 14 doctors here? I mean, we only have 4,000 people. That's our job with you, to listen to you, to say, and the board. I mean, these boards are, I almost fell over when I first met the clinic board. They have been working night and day. The engagement of the community and of the board members taking their responsibility literally to the mat. It is not fun being a volunteer or a public elected board member to have to do what they just got done doing. And they did it faster than almost any board I've seen in the state of Montana.
And you know what? They have to be applauded too, because
I
there has been other boards that people have gone to with other problems in the past, and the boards they've ignored you, they've, you know, yeah, I mean, they did, I think, what the community had hoped that they would do. So.
That's good.
I'm Jim Ward with the Human Resource Council, and one of the things that we do is work with a lot of low-income and moderate-income folks, and traditionally have quite a few rentals up and down this beautiful corridor. And one of the things that we've heard on the clinic side is that if people make an appointment for a particular issue, they can't see the medical provider for anything else, which I understand. But what's being said in the community is that even if I'm a diabetic and have a terrible problem with my diabetes, and I made an appointment for the sniffles, I can't be seen for my life-threatening problem. So my staff have been saying, no, that's probably not true. And I know you guys will tell me that's not true, but how do we together start to educate the community again that the clinic really is interested in a holistic health, and that if you have a life-threatening problem, you're going to see a medical provider. But that's not what's being said in the community.
And I understand some of that happen. And it is, I hear lots of what you just said. And Regina and I have been working, this poor woman's been working overtime too, about saying, oh, heaven's sakes, how hard can we make it to let people get into our clinic? We've done a pretty good job making it pretty darn hard, right?
Exactly.
Well, it's like, okay, it's a new day, and why are we here? We are here for every patient, and guess what else we're here for as an FQHC, Federally Qualified Community Health Center? We are here primarily to take away the barriers for anyone who's low income and or has other barriers to health care, such as a mental illness, disability, whatever it's been. So that message was not being delivered very effectively from leadership, okay? So it's a new day, and we are every minute delivering that message time and time again. And literally, as we unwrap the big picture and try to get a hold of that, Virginia and I at the little tiny level are unwrapping it minute by minute with every single small numbers, staff members, to say, it's a new day, this is what we're here for. Is this the place for you? We hope so, but this is what we do here. I don't know what you used to do here.
So
I'm
how
not
do we-
saying good or bad, but it's a new day.
Yeah, can we help? We have about 65 rental units in the community, and certainly would be willing to help get that message out, because it's a barrier, I think, to people's health.
Right,
And then
absolutely.
just want to applaud the leadership of the boards. One of the things that we were doing is working in Valley County, as I was mentioning to Cindy earlier, and so she's actually somebody that board members of the clinic there would call when she was at the Butte Community Health Center, and she was, really a great advocate. But we had put in a grant for Community Health Center from Valley County, same time Mineral County did. Mineral County got more points, and you got that grant. Part of it is because you have that board structure that you do. So I just wanted to say that the leadership here has been outstanding. Ravalli County has 50,000 people, no health clinic, no community health clinic there. Mineral County has one, and it's a wonderful, wonderful service, and it's something for all of us to be proud about. And that's why it disturbs me when there's people in the community who have been misinformed. And so, at Human Resource Council, our staff and folks are ready to help you get that education thing going again, because what you have is very unique here. And as you know from being in the business, this is an incredibly unique situation here, and you are a leader in some ways.
Yeah, that's why we have two interim CEOs, and probably some of you are wondering, well, why are two? Is I don't know squat about, federally qualified health centers. I know the traditional model in a small town is like I had up in Malta. I mean, we had a clinic, but it was a federally certified rural health clinic, hung on to a critical access hospital with some assisted living beds and some long-term care beds. So I would not have come here, to take on the challenges, of which there are many, in Superior, if Cindy had not been here. If someone like Cindy, especially Cindy, had not been here, because she is the expert in the area, certainly on the FQAC. I don't know if you know it, but she also helped Steve Bullock, during the legislative session as well.
Okay, I only paid him $5.
She's a good one. She's a good one.
Too much.
She really is.
I mean, go ahead, because it's about the
Okay,
community.
Right,
I have another question for you. About, what was it, 3 or 4 months ago, our hospital guild, when we were part of the hospital, we were doing a medication assistance. Because we had people in the community who could not afford their medication, they couldn't afford the
Co-pays.
yeah, the co-pays or anything, and this was last December, because it was during the Christmas program. Anyway, we were